Hello, Watsons. I'm Samantha Purvor, and welcome to Let's Talk Wellness.
To get more tips on wellness, like us on Facebook, follow us on Instagram and TikTok, and subscribe to our YouTube channel. Make sure to hit that notification bell so you are always updated with health tips.
Isa sa dapat nating pagtuunan ng pansin ngayong season of eating, ang nerve health. Sometimes yung nerve pains at mga pamamaga ay nakukuha natin dahil sa unhealthy diet. Nako, if you are excited for that all-you-can-eat buffet, watch this episode muna before you feel the symptoms. We're also encouraging you to join this discussion. As a matter of fact, we're interested in finding out what you learned from this show. So guys, comment down below what you learned with the hashtags Let's Talk Wellness and hashtag Nerve Health. Don't forget to like us as well on Facebook. We will choose 5 comments for this show. So kung isa kayo sa mga napiling comments, you may win 1,000 pesos worth of Watson's GC. Remember, more comments means more chances of winning. And guess what? There's another way to win. Again, like Watson's on Facebook, share this and tag 3 of your friends in the comments section with the hashtags Let's Talk Wellness and hashtag Nerve Health. We will choose 10 winners. More tags, more shares, more comments means more chances of winning. Now, joining us in our wellness talk and to help us understand nerve health, we have one of the top doctors in the country, Dr. Tony Leachon. Hi, Doc.
Hi, Samantha, and hello to our viewers.
Doc, thank you so much for joining us today, to give us a better picture or understanding of the topic. Can you tell us exactly what is the nervous system and what exactly is the role to our body?
Well, your central nervous system in the nervous system is actually the command center of the body. It originates in the brain, and then from the brain, you have the spinal cord area. So it controls your movement, it controls your body system, your processes, your senses, everything, right? But it has other functions aside from breathing, your heartbeat, digestion, and of course, sexual development. Because the nerves from the brain, there's one nerve, we call it the vagus nerve. It's the longest nerve in the body that would actually traverse from the brain up to your reproductive system. Kaya yun, napakahaba. Now, yung brain natin, yan yung important function niyan. Ayaw mo magkaroon ka ng stroke kasi that will be debilitating. Yung spinal cord naman, nandyan yung mga nerves. Kaya importante din na yung spinal cord natin ay intact, and therefore that will be important also for the well-being of the patient. So, akala natin hindi importante discuss. They're very important. Kaya ako, I would really love to discuss and of course inform our viewers on how the nervous system would function.
So coming from that thought process, how exactly do we take care of our nerve health? And ano ba ang dapat nating iwasan pagdating sa pag-alaga sa ating nerves?
Yung mental health is important because mental health would also dictate your physical health.
Very true.
And therefore, since mental health yan, involved tayo right now on how to make the brain and the spinal cord healthy. So there are many ways. And one of one of the things na kailangan natin is to rest your brain. Kaya kung kailangan magpahinga. And sleeping is important. Number 2, ang kailangan din natin is to exercise. Because if you exercise, you release a particular hormone. Ang tawag ay endorphins.
Yes, feel-good hormones.
That's the happy hormone. And then kung happy ka, ang disposition mo okay. And therefore, it also reduces your stress level. So that's the way na pinapaganda. Of course, meron din tayong mga medications to improve your brain function.
Okay.
And we can use and we can take those medications if we think na meron tayong problema in terms of mental health or trying to improve our mental health status.
Nako guys, so you heard it from Doc Tony mismo. Be sure to stay healthy. Pero Doc, let's just say that we aren't able to take care of our nerve health, no? What are the symptoms of possible nerve health problems? And also, what are the medical disorders that can cause neuropathy?
Well, the symptoms are basically numbness.
And the fingertips.
You're right. Okay. Fingertips or maaring sa toes. Like
Extremities.
extremities. Usually in diabetes, ano yan glove stocking deformity, distribution. Ibig sabihin, ang nangingimay sa'yo, fingers and toes.
Okay.
Right. But meron din one particular extremity. Let's say, masyado ka nagko-computer, mahilig kang mag-gadgets, you develop, let's say, nerve problem. You heard about carpal tunnel syndrome?
Yes.
May naiipit na nerve. There's a median nerve.
Yes, Doc.
Or sometimes here, the radial nerve.
Yes.
Oh, naiipit yan. Kasi too much use of the hand using your gadget. Yan ang uso ngayon.
Overuse.
Overuse. So you can have that. Or you can have problems with stroke. Na-stroke ka. Sometimes after the stroke, doon sa area ng weakness, wala kang pakiramdam. Or immune-related illnesses, mga lupus, mga pasyenteng merong mga rheumatoid arthritis,
Yes.
or accidents na
Yes.
na severe yung muscle and nerve, and sometimes ganun. Or pressure to a certain organ system or extremity. Pwede may
Right.
naiipit, yung pala luluwagan mo lang, di ba? Okay. And the other one, toxic substances. Ang dami yan. Alcohol is one.
Okay.
Alcohol can cause also a lot. And of course, those mga illegal drugs can also cause you neuropathies. And so tawag namin with problems related to the nerves, a medical term is we call neuropathy. Right? So, a lot of disorders ang meron nito. And ang iba reversible, ang iba hindi. Like say, ang diabetic neuropathy may not be reversible. And around 10 million Filipinos may diabetes and 50% would present with nerve damage. But meron medications na nagpapa-improve nito. But there are also some vitamins which can actually reduce the symptoms or improve din yan because of the effect nila on the nervous system. So, here we are na meron naman, may silver linings naman for patients experiencing this nerve problems, tingling sensation, numbness. Lahat ito, merong solusyon. But you have, of course, to see a doctor or perhaps read on how to address these particular nerve problems related to a medical condition.
Right. Very interesting, Doc. Nako, Doc, thank you so much for clarifying on those details. As a matter of fact, if you have any early sensations, yung mga pamamanhid, tusok-tusok, loss of reflex, loss of sensation as well, no, Doc, please make sure that you go to your respective doctors to check if you have problems with your nerves or as we know it as neuropathies. Eto, Doc, how exactly should we check ba? Is there a system that we can check for ourselves at home?
You need talaga professional help. Oh, okay. Just for example ako.
Yes.
So, physicians should heal also themselves. I have to go to a rehab doctor. And one time, I had this particular problem.
Numbness?
Numbness
Pain?
here. O hindi ko akalain, ganun. And then, I went to a rehab doctor. Nagkaroon ako ng frozen shoulder kasi hindi ko na-control ang pain.
Interesting.
Right. Interesting. So, nagpunta ko dun sa rehab. Sabi ng doctor, naiipit yung nerve mo. I have a ulnar nerve syndrome. So, ang ginawa niya, the typical, ito very important. Cold compress. Yan ang, meron acronym dyan eh. One, they call it the RICE, R-I-C-E.
Yes.
So, rest. Yan ang kailangan. And then, immobilize. Right?
Yes.
Okay. And then, compression.
Correct.
and then
Elevation. Yes.
Right, yan ang pwede nating ituro. But you need help. So one session lang ako with the rehab. Ginawa ko yan. 1 week, tanggal. So empowerment, very important. But of course, meron din ako mga medications na tinake. And right now, wala na, magical.
Wow.
And then the other one, dahil my wife is an occupational medicine, alam niya yan. Ang tawag niya, ergonomics. Pangit daw ang posture ko.
Yes.
So, pag nagko-computer ka pala, dapat pala head level, hindi ka nakatumo.
Correct.
Ito, sasakit. Pagka sumakit dito, may mga nerves from the cervical spine going here. Kaya pala nagnanam.
It's radiating.
It's radiating. So
galing.
sabi niya, ikaw, mali. Then, sabi niya, ikaw kasi, you're leaning dun sa table. Dapat hindi. Dapat ayusin. Relax. And then, isa pa, dapat straight yung body mo.
Correct.
Right. And then, every 1 or 2 hours, kailangan daw tumayo ka. You need an expert para at least ma-empower ka to do that. Plus, mga medications.
Would you recommend taking vitamin B for addressing all of your neuropathies?
One important factor is the doctor-patient relationship. All right. So, ang nagpe-prescribe usually ng medication ay doktor. But there are medications that you can buy without prescription. So, therefore, napaka-importante mo maintindihan yon. Right. So, these vitamins, yung vitamin B complex,
Yes.
can actually be helpful. Kasi they can be cofactors or coenzymes that will actually be helpful in the metabolism ng nervous system, particularly sa rebuilding ng nerves mo
Yes.
or strengthening that. And we can see that, no? Kaya importante din. And there are studies and researches that would say that vitamin B complex may be important in maintaining mental health as improving also your nerve health. At ako naman, in my own personal experience, nakagamit din yun. But eventually, hindi ko na ginamit kung okay ka na. Alright. Kasi ang importante niyan, you're empowered right now to do things na pwede mong gawin without medications. But I tell you, medications really help.
Very
And then,
true.
of course, the
Yes.
other non-medical measures to improve your nerve health.
Yes, very well said, Doc. Thank you so much for bringing light to this, especially during this season. If you need information about vitamins, maintenance medicine, and other essentials, ask your Watson's pharmacist to help guide you with a wide range of vitamins, supplements, and medicine in Watson's. Speaking of essentials, tune in dahil up next we will talk about vitamins that can help you.
When your B complex can't compare to Neurogen E, with more vitamins to help repair and protect nerves and help improve mental sharpness. I feel the difference. There's plain B complex and there's Neurogen E. Only 14 pesos.
Good day po! It's time for Dagdag Kaalaman with K. Matienza and K. Matienza. Alam niyo ba, ang Watson's brand Vitamin B Complex has the same effect as the other brand. Get 30% off when you buy 30 pieces. Kaya we switched to Watson's brand vitamins and supplements for quality and savings. Save up to 80%. Want to know more? Ask your Watson's pharmacist.
Mahalagang paalala, ang Watson's MGX Plus Mangosteen Rind 500 mg, Watson's Flaxseed Oil 1000 mg at Watson's Silumarin 300 mg capsules ay hindi gamot at hindi dapat gamitin panggamot sa anumang uri ng sakit.
Na-experience mo na bang magkaroon ng pamamanhid o tusok-tusok? Baka sintomas yan ng nerve damage. Continue to keep your nervous system healthy and achieve more ways to wellness. We can start with B vitamins. Ang vitamin B1 helps keep your nervous system healthy by helping convert carbohydrates into energy that our nerve cells need. Vitamin B6 naman helps in making sure your nerve fibers are able to transmit signals effectively by helping make neurotransmitters. Lastly, ang vitamin B12 ay tumutulong sa pag-regenerate ng nerve fibers sa pag-repair ng nerve damage. People with diabetes, which can also be a cause of nerve damage, can also be vitamin B deficient. Choose from the many options of B vitamins right here at Watson's. One product is Neurogen E. One capsule is 14 pesos and 25 centavos. This is used for the treatment of B vitamin deficiencies manifested in abnormal touch sensation. Meron siyang 300 milligrams of vitamin B1, 100 milligrams of vitamin B6, and 1,000 micrograms of vitamin B12. If symptoms persist, please consult your doctor. And of course, you can save through the Watson's Vitamin B Complex. This is only 4 pesos and 75 centavos per tablet. Meron itong 100 milligrams ng vitamin B1, 5 milligrams ng vitamin B6, and 50 micrograms of vitamin B12. Again, if symptoms persist, please consult your doctor. And if you need assistance, you can always ask your Watson's pharmacist. We have a wide range of vitamins, supplements, and medicines in Watson's. You may get them through the Watson's app or the 1,000 plus stores nationwide. Plus, you can also get your wellness essentials and maintenance medicine delivered to you monthly through our Watson's Subscribe and Save program. This has been Samantha Pervor saying there are more ways to wellness in Watson's. If symptoms persist, consult your doctor.